Hi everyone, my name is Vika Gautham, and today I will be presenting Embracing Neurodiversity through Japanese Perspectives on Well-Being, exploring the relevance of Ikigai and how it can help therapeutic practices for ADHD with individuals. Today, specifically, we will explore how the Japanese concept of Ikigai can be integrated into Western therapeutic practices, particularly third wave psychotherapies like acceptance and commitment therapy or dialectical behavior therapy, known as ACT and DBT, respectively. Our focus will be on individuals with ADHD and depression, a population that often faces unique challenges in traditional therapeutic settings. Ikigai is a concept that refers to the intersection of four elements: what you love, which is passion, what you're good at, which is vocation, what the world needs, which is mission, and what you could be paid for, which is profession. These elements overlap to form a sense of purpose or life meaning. In Japanese culture, ikigai is a motivating force that contributes to a fulfilling life, which is often associated with longevity and well-being. Next, I'll be moving on to third wave psychotherapies, focusing on ACT and DBT. The first wave behaviorism focuses on observable behaviors and their modifications through conditioning. The second wave introduces cognitive therapy, which brings attention to cognitive restructuring and the role of thoughts in mental health. The third wave, which includes therapies like DBT and ACT, integrates mindfulness and values, reflecting a holistic approach to well-being. Third wave therapies have significantly integrated Eastern influences, particularly mindfulness and the acceptance of thoughts and emotions. For instance, mindfulness practices in therapy are derived from Eastern meditation traditions and help patients stay present and detached from negative thoughts. In ACT, values-based work guides patients towards actions that align with their core beliefs, enhancing motivation and resilience. DBT, which is highly effective in treating borderline personality disorder, incorporates a dialectical approach, balancing acceptance and change, similar to the Eastern philosophy of yin and yang. Next, we'll be talking about the problem, the population, and the objective for this. So the population, as I mentioned, we're focusing on individuals with ADHD and depression. And these co-occurring conditions present unique challenges in therapy, such as impaired executive functioning and a pervasive lack of motivation for some. When ADHD and depression co-occur, these challenges are amplified. The impaired executive functioning associated with ADHD makes it even harder for individuals to overcome the motivational deficits caused by depression. The combination creates a cycle of avoidance and inactivity that's often difficult to break. Traditional therapy falls short in addressing these dual deficits. Many therapeutic approaches, particularly those that rely on cognitive restructuring or behavior modification, may not be as fully effective for this specific population. These approaches often assume a level of motivation and executive functioning that some individuals with ADHD don't have, or they may struggle with as well. As a result, patients may find it difficult to engage in therapy consistently, leading to frustration and limited progress. This is why it's crucial to explore alternate approaches, such as integrating values-based work, like cultural concepts such as ikigai, which can provide a stronger, more personalized motivational framework for these individuals. By focusing on what truly matters and creating a structured, step-by-step approach that aligns their values, we can help them overcome these barriers and make more meaningful progress in therapy. My objective is not just to add mindfulness to therapy, but to supplement values work of third-wave psychotherapies. While mindfulness is a critical component, focusing on values-based work provides a stronger motivational foundation for individuals with ADHD and depression. To supplement this thought, I interviewed professionals, specifically therapists, and two key themes emerge: the theme of aim motivation and the theme of the need for linearity. In my interview with Vander Brunetti, they gave their thoughts on these two themes. Here they are. And here are their thoughts on linearity. So moving on, aim motivation is a significant challenge for ADHD individuals. With depression, depression can significantly diminish the brain's reward system and reduces the ability to experience pleasure from activities that would normally be enjoyable. This leads to a pervasive lack of motivation, making it difficult for some individuals to initiate or sustain engagement in therapeutic activities. ADHD further complicates these challenges by impairing executive functioning, which includes skills like planning, organization, and task completion. Individuals with ADHD may struggle with procrastination, disorganization, and avoidance behaviors, making it difficult to follow through on these interventions. A key strategy in addressing amotivation is helping patients reframe their self-image by focusing on intrinsic values such as learning, growth, or curiosity. For instance, a patient who perceives themselves as dumb due to academic struggles can shift this narrative by recognizing a value in perseverance or self-improvement. Instead of focusing solely on external achievements or performance, therapy emphasizes aligning actions with these core values, which can be more motivating or fulfilling. By centering therapy around what genuinely matters to the patient, values-based interventions can help shift the emphasis from external validation, such as grade or approval of others, to internal fulfillment. This approach is especially important in individuals with ADHD and depression, as it fosters a more sustainable form of motivation that is less susceptible to the fluctuations of external feedback. In therapy, it's also important to differentiate between short-term and long-term goals. Short-term goals are immediate and achievable, helping to build a self-image and confidence. By accomplishing the smaller tasks, the patient can improve their self-image and gain the confidence needed to tackle more significant challenges. Long-term goals align with broader life aspirations such as career development or personal fulfillment. Therapy focus on how these short-term goals can help build the foundation for achieving these larger, more distant goals. Next, I'll be moving on to linearity. So patients with ADHD often face significant difficulties in maintaining focus and following through on tasks, particularly when these tasks seem disconnected from their personal values or larger goals. This disconnect can lead to a fragmented and inconsistent therapeutic experience where patients may struggle to see the relevance of their efforts, leading to decreased engagement. When therapy lacks a clear connection to a patient's values, the work can feel arbitrary or irrelevant, exacerbating the natural tendencies of ADHD, such as procrastination and disorganization. Some patients may start tasks with enthusiasm, but find it difficult to maintain the momentum, particularly when the task doesn't seem to lead to immediate or meaningful outcomes. This is where the follow the thread approach comes in. The follow the thread approach begins with helping patients identify their core values, those that resonate deeply with their identity or sense of self. These values form the foundation upon which therapeutic goals are built. For example, if a patient values creativity, therapy might focus on activities that allow them to express and explore this aspect of themselves, thereby making therapy more engaging and personally relevant. Creating a clear and linear pathway for values to actions is central for this approach. By mapping out how small, value-driven actions lead to larger, meaningful outcomes, therapists can help patients visualize the progression of their therapy. This linearity helps patients with ADHD who may struggle with seeing the big picture stay motivated and focused. It also provides a tangible sense of progress, which is crucial for maintaining engagement in therapeutic progress. So some other considerations to take in mind, one of the key considerations in therapy is adaptability. Each patient is unique and their therapeutic needs may change over time. This requires flexibility in therapy, allowing us to shift the focus between values-based work and other types of therapy, such as supported therapy. And for patients with ADHD, we may need to tailor interventions to address specific executive functioning challenges. This can involve using tools like visual aids, reminders, or technology to support organization and follow through. So in conclusion, we've explored how Ikigai can be integrated into Western therapeutic frameworks, particularly for individuals with ADHD and depression. By focusing on values, we can enhance motivation and provide a clear, more meaningful therapeutic pathway. Thank you for listening, and I hope you have a great day.